The following segment is sponsored by Moda Health.
Welcome back to Afternoon Live. May is Skin Cancer Awareness Month, and with our rainy, cloudy skies, you may think you don't have to worry as much as people living in states like Arizona. But Oregon ranks among the top 10 states for melanoma cases. Here to share more, we welcome from Moda Health, Vice President of Diversity, Equity, and Inclusion, Karis Stoudamire-Phillips is back with us, and from OHSU, Co-Director of the Skin Cancer Imaging Center, Dr. Alexander Witkowski is with us. Great to have you both back here.
Good afternoon.
Let's talk about this, Karis. This has been the focus of May, but really something we should be focusing on all year long.
Absolutely. So for Moda Health Month this month, we know that everyone is going to be getting back outside. We have been cooped up in the houses for far too long, so people are going to get out. Summer officially begins next month, and so we really wanted to bring awareness to prevention of skin cancers and just overall skin prevention and health, skin care health. And just prevention of all different types of skin cancers, and just want to let people know what they need to do to be safe in the sun.
So let's talk about those things, what people need to do, doctor.
Absolutely, yeah. So number one is to perform and practice safe sun behavior. So avoidance of the sun between the peak hours between 12 and 4 p.m., ample use of sunscreen and reapplication every 2 hours. If you can, wear long sleeves if you're out on the water, and wear a hat.
You hear about we're not getting enough vitamin D. Is there something to the, you're okay for 20 minutes and then put on your sunscreen?
I'm sorry, if you're 20 minutes in the sun is okay, I would actually say probably not. It's best to apply your sunscreen 20 minutes before you go into the sun, just to make sure that that's very clear.
Can we talk about the signs and the symptoms when it comes to melanoma that people need to be looking for?
Absolutely, yes. So we're looking for moles on your body that are different than the rest. So something that you notice is different than all the other moles on your body. It may be firm, rapidly growing. It may have asymmetry or irregular borders. If you have something like that, please reach out to your doctor and ask them for an in-person visit.
And of course, going every year to get checked out as well.
Absolutely. Annual skin checks are recommended. If you've ever, for the general population, if you've ever had a melanoma, then you already know. If you don't, we remind you to come in every 6 months for a skin check. And then also it's important to understand that with the change of the pandemic, the way we've been seeing doctors has changed a little bit. And we do have new breakthrough programs where you can see your dermatologist in a virtual setting. Traditionally, we use a device called a dermatoscope. It's like a magnifying lens that lets the doctor or the dermatologist see your moles in high definition in the office. Now we have programs that you could actually do this from your home here at OHSU.
Which is a really cool thing. We talked about this statistic. You would think in Oregon you're not seeing near as many cases as much of the South, the Midwest. Well, there's just so much more sunshine. Why is Oregon so, it's in the top 10?
Absolutely. So we're actually 6th position, so it's even worse than top 10. We rank number 6 in the United States for the number of skin cancers and the number of skin cancer deaths. This is actually due to the population. Of course, we have a large Caucasian population here, but also the sun behaviors. So intermittent sun exposure, so the type of exposure where you have an on-off switch, so 3 months of no sun, all of a sudden the sun comes out, everybody wants to get their vitamin D, and so that behavior where it's on-off switch, it's actually worse for the skin. And so the DNA mutations that occur from UV light, they can occur even still through the cloud cover.
Yeah, I mean, you heard me, the Oregonian right there. Like, can't I go 20 minutes without, you just like want to feel, you're still going to feel the sun though with your SPF on. Let me tell you.
Yeah, we recommend vitamin D pills.
Exactly.
Without sunscreen.
Lots of fruits and vegetables too, can cover that. Okay, let's talk about this though. There is guidance for parents for their children as well.
Yes, being the mother of 2 young boys who love to be in the sun, really lather on that sunscreen, just like Dr. Witkowski said. Put that on 20 minutes prior to sun exposure and just, yes, reapply. If they get in the water, you do need to reapply. And then also skin protective wear. I have an 11-year-old who hates the fact that I make him wear a shirt to the pool. But we have to be preventative and be safe out in the sun. And I also want to just share that people of color need to know that we are susceptible to skin cancers as well. And Dr. Witkowski will share that we actually have a higher prevalency of melanoma and different skin cancers and death due to those skin cancers. So just because you may have more melanin in your skin does not mean that you are exempt from skin cancer. So please, please put on your sun protection, your sun protective wear, your sunglasses, your lather on that sunscreen prior to going out in the sun, and just really be cautious.
And Karis mentioned this, and I know you want to touch on it too, Doctor.
And I want to build on that. So yeah, skin cancer affects everybody, all phototypes, all skin color types. And while it's rare in people of color, it still occurs. Just to draw back historically, Bob Marley died of melanoma skin cancer, which happens to be one of the worst forms of cancer that you can have. And unfortunately, it spread to the other organs. And so it's really important to take a look at your palms and your soles. Notice that there's no melanin on my hands, and there's no melanin on anybody's hands, regardless of the color. So please take a look at the palms and soles of your feet. Even if you think you're not at risk, everybody is at risk.
And I know that there's a great resource online that you want to mention as well, that people can check their moles. And as far as seeing imaging?
Yeah. Thank you so much. Yeah, so OHSU here in Portland, Oregon, we offer a virtual spot check. So you can communicate with your dermatologist in a virtual setting from home. And more importantly, we have a no-cost program where we can lend you a device just like this that attaches to your smartphone. We can send it to your home, or you can take a high-definition image, just like you would be seen in a doctor's office from the convenience of your home. It's very easy to find. Just to go on Google and type in OHSU spot check for more information.
Love it. Such great tips. Thank you two again for joining us.
Thank
you so much.
Yeah, and for more information, we'll have a link to modahealthminute.com on our website at KATU.com. We'll be right back with more Afternoon Live right after this.